has got to be one of the most impromptu mugshots and coffee, and I have a really special guest today. This is Xander.
Can you say hi? No? Can't say hi?
He's a medalist in all sorts of things, and it's all because of Trent, who is a triathlon guy and a pharmacist, and it seems to be an oxymoron in a lot of people's brains. We're going to talk about a little bit of that. And we're not doing coffee today. We're actually doing meal replacement shake because we're into nutrition and we can do that. So this has got
So this is my first run of this stuff. Huh?
fresh ginger. It's almost all fruit. It didn't get blended really well today because we're on an inverter and power and all that. But there's a ton of ginger in there. So. Look, I mean, if you look at my arms and I look at your arms, and there's obviously a difference, right? So it's hot here. You're up early because of the triathlon stuff. First, let me set the stage a little bit here. You've done Kona. Mm-hmm. You've done Whistler, was it? Or in Whistler?
Yeah, I just did Whistler.
And how many
I've actually
others?
done quite a few, so this will be my 25th Ironman. Furthest I've been is New Zealand. I did New Zealand in 2007.
Did you really?
Yep, in Topo.
What do they give it to the guys who don't ever run it? The Noodle Mans or something? Right? Wimp. So, what got you into it? How did you get started in this?
Well, when I came out of college, I got into golf, and I was golfing like crazy until I got to the point where it was a classic golf. I got down to a 2 handicap, and I was miserable and unhappy because I couldn't beat a scratch, like an actual positive scratch golfer. I just got to the point where I just would go out and I would shoot a 75 and I'd be upset. So, I mean, seriously, I mean, it was just, I think that's golf. It's like you're always wanting to improve, and I think I found where I was sort of at my limit. I just couldn't seem to get to that next step, and I think frustration just sort of got the better of me, and I was like, I gotta go maybe back to some other sports where my roots are at, you know, and honestly, growing up, I never was into endurance sports. I played soccer, which, you know, obviously you can chase a ball for 5 miles and you don't notice it, but then I got into, you know, I did the short distance track, like sprints, and I used to think, you know, I had friends that did like half marathons, and I'd be just like, well, why would you want to do that? I don't get it. Why would you want to run 13 miles? Actually, running 13 miles was incomprehensible to me at that time. And I was probably around 30, you know, and then actually I decided I'm going to do some 5Ks, and then the staircase happened, started doing 10Ks, I got to do a half marathon, I was going to do a marathon, and I did a lot of marathons, and then I'd always watched Kona on TV, and I was like, you know what, triathlon looks cool, I mean, because I like to bike, so I bought a tri-bike. First triathlon I ever got into was a half Ironman. A lot of people thought that was a big thing to bite off because it's pretty long, doing, you know, full 1.2 mile swim and then a 56 mile bike and a half marathon all combined. Yeah. But I ended up doing really well. I went to Florida Walt Disney World and got done, and you know, next thing you knew, I went into I came back from that event. I felt like I was trained up pretty good. It's here in Arizona, obviously. I did that in May, and at that time there was only about 5 full marathons in North America. And Canada had Penticton, so I looked online and they actually had some opening slots, and I was able to get into it. I had about 4 months to like train up to a full, and went up there, and I remember just being really, really scared.
Yeah.
And I trained a lot. I mean, you know, because I had been warned that was the most difficult Ironman in North America at that time. And, you know, I went up and actually did really well. It's funny, I still have a poster that they did the next year. They took a picture of me and they put it on the athlete's brochure the next year, and I still have that in my garage, which I thought was ironic. But then I got through it, and then the next thing you know, I think once you do a full, you want to know the next question, was it fluke or can you do it again? And then the next year I signed up for another one. Actually did 2, and the next year I did 3, and the next year I did 4. And eventually did 5 fulls, like within a 12-month time frame.
That's awesome.
But that got to the point where that got to be so all-consuming. I think that's the OCD in me, and then it pulled back, and I came back down to like 4, 3, 2. And then at a number of years I did 1, then do 2. But I think what I found is I'm never going to be the fastest guy on the planet. There's amazing athletes out there. I think you learn that.
Right.
And even in, me being 49 now, these guys are going out putting some sub-10 Ironmans. If you go out and try to be a qualifier for Kona,
Right.
I got into Kona in 2012 because they did that really unique program called Legacy Program. And Legacy Program was when if you had done 12 Ironmans total and done one the prior 2 years and were signed up that year, you qualified. And it really wasn't a lottery. You sort of submitted a resume. And they used to have 200 slots for Kona where you could do the lottery. They carved that back and made 100 slots for Legacy and then 100 slots for the lottery, which still exists.
My son about one of his half marathons recently and getting ready for the Lake Padden Tri, etc. And he had just taken me out for a ride. Just whooped me really bad. And I said, yeah, David, I was never really the fastest guy, but I never missed a meal. I was always there for mealtime, right? So I've noticed it's being passed on. I passed on from me to my son. You're doing it with Xander.
Yep.
Tell me about his medals and what are you guys doing?
Well, I think as a parent, the one thing you want to do is if you try to take care of yourself and have goals and are into athletics, you want to pass that on. You want to start them really young, when they can sort of grow up. So what I did is I went out and I looked at this idea when he's actually still only 2. Started digging around, and I was actually looking at an obstacle course race, and I noticed that they had something called the Little Monkey division.
Wow.
And it was like just a half-mile course, and you could do it down to like 2 years of age. I mean, you could go out there, but the nice thing is the half-mile course, parents can do it with them. So that's a great idea. So I signed him up.
Yeah.
Just wanted to sort of test the waters and see how it went. And then I went out and did it, and I thought he did pretty good. I mean, for being that age, he was a little trooper. I've got pictures of it, he's just sort of all into it, and and it's a little bit of a struggle, and you got to help him through some obstacles, but it was good bonding.
Right.
And he got done, and he seemed like he's so proud of that medal at the end. So then I started, subsequently looking for new races, whether it's Spartans or even Ironman. Ironman always has, every race pretty much has an Iron Kids. That's not an obstacle, it's just like a half-mile to a mile run. But you can go in there and they get a nice, it's called an Iron Kids medal.
Yeah.
1, 2, 3, 4, 5, 6, 7.
Yep.
Put it here. Good job. Very good. Big champion.
Yeah, the toughest one there was this one we just did in February. It was actually an 8K. But the funny joke was, it was the shortest race you could get a medal. They had shorter ones where you can't get a medal. So we're like, okay, that's not good. We're sort of medal snobs. So I went and did it, and I did have to admittedly carry him a little bit for 4 miles because that's a little long for a 4-year-old.
Yeah.
But he did good. Parents can go do it. And so we've got 7 to date. He's 4 now. And I asked him the other day. I was like, what's your goal? He's like, I want 100 medals. So
Xander.
So it's Xander.
You won 100 medals?
You want 100 medals, don't you?
That's a lot.
And how many you got right now? Remember?
6,
No, you got 7.
7.
Yep.
7 now and 93 to go.
93 to go.
That is going to be awesome. When I think of a pharmacist, I think of the guy that's in the white smock and he's behind the counter. So you're a, what's the technical term? Licensed pharmacist?
Clinical pharmacist.
Clinical pharmacist.
Yep.
Okay, and how's that different than what we
Well,
typically
I think, most people, when you see a pharmacist, and I would argue that I was even the same way before I even went to pharmacy school in U of A in Tucson. I didn't really know all the options you could do in pharmacy. Most people see the retail pharmacist behind the shelf, at Walgreens and retail in the white smock. They're valuable. They definitely play a role in the service. Well, my role as a clinical pharmacist, I work in the hospital setting, in the acute care. So what I do is I actually, work up on the floors. So I work with the physicians. I actually don't do order entry. I don't dispense meds. I don't do anything. It's all cognitive based. So, we're dosing antibiotics, doing consults. My clinical practice is actually pain management. But our job is multifaceted. It's seeing patients, working with them, counseling, look at their meds, trying to give them the best regimen we can. You know, working with the physicians or nurse practitioners, physician assistants, and the nurses while they're in that acute setting. Once they're discharged, you know, then they're sort of away from us. I mean, we just really work on them while they're in the house.
What in the world is it about our addiction to these kind of endurance sports? What is it that we learn?
You know, I think that's a good question. Sometimes, and even asking it now, it makes me think back. I remember when I got into it, it's like part of the thing in the beginning is more about, well, I don't know, can I do it? You know?
Yeah.
And then you find out you can do it, but I think what you do is you end up spending so much time out there, it's like alone time. There's a lot of time to think about life, you know, just all the trials and tribulations you might have, sort through them. I mean, there's some quality about that, you know, because I train with some people, but I actually train a lot on my own, by myself. Right. I'm fine with that. But now, actually, I mean, I think that you just sort of learn, you know, what you're made of. I think until you push yourself, because like Ironman's great. I one time learned, I once heard a lady that was actually doing those cross country like races, you know, right. And she made a statement once on TV about how Ironman taught her how to suffer.
Yeah.
And I think there's truth to that, whether it's Ironman or some other long endurance sport. You know, there's something about taking yourself with something that long and hard, you're going to hit some wall at some point.
Right.
And you got two choices, to give up or to not give up, you know. And to me, that's the only two choices you got. There's no in between.
Right.
And I think I've never given up, you know, and no matter how hard you hurt, whether your legs are cramping, whether you know, you want to barf, whatever it is, you can get past those walls. And those are the things that I think translate back into your life, all the things that are actually more important than endurance sports. You know, your family and career and all those things where things don't always go as planned. But you know what? If you stay with it and just keep on grinding through it, you're going to get over those humps and you're going to end up being successful. And I think that's the stuff that, for me personally, that's what I get out of it. I mean, I still enjoy signing up. I find that because I'm so busy in life, I need that goal. And having goals and setting goals, both health and career, it keeps you motivated, it keeps you going. Because if I didn't do them, I don't know what I'd probably just work all the time when I lose my shape.
For one, I'm completely thrilled at getting to meet Trent because he's both clinical pharmacist and endurance athlete, meaning he knows a lot about pain management, and he seems to be able to pass that on to his son Xander. So if you have questions for him, join us in the conversation at 360min.net. And the invitation is open, as always, to subscribe to our channel and meet a lot more of these terrific guys.